Welcome back. Dr. Dennis Abbott, Director of Predoctoral Curriculum and Integrated Learning at KCU Joplin Dental, talks us through regular exams and the critical role they play in screening for oral cancer. I'm so glad you're here to do this.
Thank you for
today,
having me.
Doctor.
I'm glad to be here.
This is so important, and I think it gets overlooked a lot of times.
Yeah, it really does. Oral cancer is one of those things that unless you're looking for it, a lot of times you don't find it. And so it's something that we tell patients. It's like by the time it hurts, it's really too late. So the best thing that patients can do, the best thing that anyone can do, is to have a dental visit be part of their regular health routine and their annual wellness type of exam. So having someone else who is there, who knows what to look for changes in the tissue, look for a sore that's not healing, look for a lump that is there that may not be noticeable. And there are several things that patients can even do if they're hoarse for more than 2 weeks, if they have a sore that doesn't heal that they recognize, or if they're having problems swallowing or feeling like there's something caught in the throat. A lot of times those are warning signs that really can help us be able to look more deeply.
Yes, and get in there and get it checked. And if you just make this part of your regular routine, and so many people don't do that. That surprises me. I mean, I've just always done it all my life, but I find I have a friend that passed away from oral cancer, and I have another friend going through some dental issues, and it's just really important to make that part of your routine.
Right, I agree. I have an uncle who passed away from oral cancer. It's one of those things where a lot of people have that connection to some kind of cancer, and so when we have patients even who have had a history of cancer, those patients are at a higher risk for developing oral cancer, and so they really need to make sure that they have that as part of their annual wellness routine.
Okay, and we know there's many famous people that have gone because of this, and so it's happening. But get in there and get it checked out, and then here's some of them right now. It's so sad that we've lost these people because of this, and maybe if they would have had the regular visits, maybe it wouldn't have happened.
Yeah, for sure. Even people like Jim Kelly, who was the quarterback for the Bills, Val Kilmer, Roger Siegel, so there were a lot of people who are very famous, Larry Hagman, who had oral cancer, and some of them ultimately passed away from it.
Yeah, it's so sad. And what you were telling me in the break room a little bit about some of the symptoms and what they go through with oral cancer, and a lot of those could have been prevented. So we can't stress enough to get into your dentist while you're watching this today. Make that appointment.
Absolutely. It's one of those deals where a lot of times whenever it's an earlier type of a cancer, surgery is the best option. And that may be the only option when it's at stage 1 or stage 2. But by the time it gets to stage 3 or 4, where it's really causing complications, that's where the treatment becomes a lot more intensive with like radiation therapy, chemotherapy, and then people have a lot of problems, difficulty swallowing. Sometimes they have problems in their balance and things like that after they've had head and neck radiation. It creates problems for having teeth extracted and things of that nature. So it really is important to try to get that taken care of as early as possible, and the best way to detect it early is to look for it.
And how often do they check for that when you go to the dentist? Do they do it every time you're there?
When I was in private practice, I checked with every patient every time they came in for their regular cleaning visit, okay? And then I'm looking, kind of around every time I see that patient, period. But at least, at a minimum, they need to try to make that part of an annual visit, that they see a dentist on an annual basis to make that part of their annual wellness check.
And a lot of people every 6 months. I go every 6 months.
Yeah, if they're going every 6 months, then hopefully every dental office is checking for that every 6 months.
And a lot of insurance covers this, so it's a benefit that you should be taking advantage of.
Absolutely.
And I visited your school the other day and went and did some interviews. Haley showed me around. It was unbelievable. That we are so blessed to have this here in Joplin.
Thank you. We're very, very proud of the school, and people out there who might not have a dentist. If they don't have a dentist, they're welcome to come to the school and be a dentist and be a patient for us, and that would be a great place where they could make sure that they're getting their annual wellness check for oral cancer.
And especially if you don't have insurance or something like this is a cost-effective way to get these screenings and everything.
Absolutely. That's why we're here. We're here to meet a need.
Thanks so much for being here.
Thank you for having me.